It's winter in South Africa. The days are short, barely time to bury the dead. A 22-year-old man is mourned in Soweto. The funeral directors here say it feels like the height of the AIDS epidemic, except when they bury the dead now, the number of mourners is restricted. The diggers must do what humans once did, and there's worse to come.
We are preparing over 1.5 million grave sites, and it's an uncomfortable discussion, as a medical practitioner, but it's reality that we need to deal with.
No money, no pay, no food. You see, it's like you are surviving like an animal.
If there is no food, people are going to die.
Khayelitsha near Cape Town is where the country's first Covid-19 case was confirmed, and it's here that a field hospital has opened in case the health system is overwhelmed.
Assalamu alaikum, doctor, and welcome to Let's Sit Down.
Wa alaikum assalam wa rahmatullahi wa barakatuh. Thank you very much for having me.
Okay, so the COVID pandemic has impacted on every sector, but let's talk about the health sector. What were your thoughts at the inception of COVID-19?
Thank you very much for the question. At the inception of COVID-19, as every other person we were all not sure of what was going on. But looking at it from a healthcare practitioner perspective, we understood the virus and we understood that it's a virus that we didn't know so much about. But knowing that it's from severe acute respiratory syndrome virus, which is a virus that is known to be very virulent, we were very apathetic on how this is going to impact our caring for the patients and what kind of symptoms the patients will present with, and not having a cure or having a definitive management for it. So it was more like I personally was apathetic, so it's made me to make some research into the virus. So what we were doing at that time was to manage patients symptomatically, but it was a very psychological and mental stress for healthcare practitioners, especially considering the fact that we are at the front line and we are exposed to the patient. So it needed us to do some research and to improve ourselves in terms of knowledge so that we can be the source of confidence for the general public.
Absolutely. Now, as a frontline worker, what was your daily experiences during the peak period of COVID-19?
My daily experiences during the period of COVID-19 was horrible is an understatement to say the least. It was psychologically depressing. So much so that you have patients that you leave during the day and you are not sure whether you are going to meet them. Yes, we are used to having such cases because we are medical doctors, we face that, but having patients die in that magnitude and not being able to help those patients, it's like going against what you bargained for when you took the Hippocratic oath. I had a friend who had an 8-hour shift, and in that 8-hour shift he had about 9 patients that demised from COVID-19 and he couldn't do anything about it. It showed that every hour of his shift he had 1 patient dying at least. So it was very, very psychologically depressing for us. And the good thing was that we were able to beef up ourselves, try to go all out to manage these patients to the best of our abilities and to make sure that we pick up little signs and symptoms that would make a difference in the patient's management. And basically we were managing these patients symptomatically because there was no definitive cure. So what gave us more succor was when you manage a patient and the patient gets to improve and the patient is discharged from hospital, then you get happy that yes. But on the other hand, you get sad when you see the mass number of people dying. So we needed to strike a balance between that. So it was quite psychologically depressing.
With considering that you work in a high-risk environment, what specific steps have you taken in averting COVID-19 transmitted to your family?
That's a very interesting question. And it was the topmost of my worry when this coronavirus came upon us. Basically, the measures I put in place regarding my family was to make sure that before I come home, I call my wife so she knows that I'm coming. So I start the process from before getting home from work. So I'm starting from there. So before I come home, she makes sure that she gets the children, she put them in a room such that I have a thoroughfare into, I have like a small area where I call my dirty area. So that's where like I doff and all that. I take out whatever clothing I have on. So I had scrubs then that I wear to work. So I needed to have scrubs so that I don't like expose my everyday clothes to getting the virus on them. Then when I get home, I have a thoroughfare into my dirty area. Then I make sure that before I get inside, I take off my shoes. I already have a box where I put it in, and I have a hand sanitizer waiting for me. So I sanitize my hands, and then I go straight into my dirty corner, and then I take off whatever I'm wearing, and I move straight into the bathroom. After I've had a shower and all that, then I make sure that all those dirty things that I bring on, we have a protocol of cleaning it in my family. And then the other thing that I did was that I made sure that all members of my family were vaccinated against the normal seasonal flu. So then we had some literature that said that it would help to prevent severe infection if you get infected by the virus. So I put that also in place. The other thing I did was to make sure that I avoided unnecessary contact with my family, because I know I have that risk of transmitting the infection to them. So I try as much as well, especially because I had a 6-month-old child, so I needed to protect them, and my mom was also staying with me, so, and she's elderly, so I needed to make sure that I had as minimal contact as possible with them. And then we made sure that we check our temperature every day to make sure that at the slightest symptoms we have, we get ourselves tested. But thankfully we were able to put those measures in place, and we were able to prevent any infection within the family.
Now, as we know that several countries are going through, I would say, the second wave now. So what preventative measures can people take now for this time? Okay,
thank you very much for that question. I must say I'm really impressed about how we've changed our lifestyle. COVID-19 has really made us, it's not a temporary change. It has changed our narratives forever. It's a new normal, exactly. So my advice basically to people is what people have been doing already. Make sure you wear your face mask whenever you are going out of your home. Make sure that you keep a distance of 1.5 to 2 meters between you
I think
and
we are
other
fine
people.
here.
Yes, yeah, indeed. Yeah, so you must make sure that you keep that distance. Make sure that whenever you have symptoms, you don't go to work or you don't go to public areas. Get yourself seen by a medical practitioner. Also, whenever you are coughing, make sure you cough into a flexed elbow and you don't just cough out. And the other paramount thing is to make sure that we wash our hands. Contact prevention is very, very key. So we must make sure we wash our hands for at least 20 seconds. Making sure that we wash our hands thoroughly with soap and water. If you don't have soap, keep your hand sanitizer. Whenever you go, you try to sanitize your hands. Also, there shouldn't be unnecessary touching. You should avoid shaking hands with other people, because you don't know if they have the virus and you could get it. Avoid touching your nose, your mouth, your eyes, and other areas, other mucosa areas in your body. So basically, those are the things, or those are the measures we can put in place. And if you are sick, try to stay at home and not expose yourself and other people to the infection.
Now, many people have been asking questions. We've been seeing on our television screens going back and forth as to when do you foresee the COVID-19 vaccination in South Africa?
That's a very interesting question. Recently, South Africa subscribed to a COVAX initiative, which is like different countries coming together to make sure that they expedite getting a vaccine. So I am confident that by January to February 2021, there should be a vaccine against coronavirus. There's a study currently going on. About 2,000 individuals have been enrolled. But the other question that will come up is who gets the vaccine first? Is the vaccine safe and all that? But basically, there's light at the end of the tunnel. Hopefully by early next year there should be vaccine, and the Medical Research Council of South Africa is also working tirelessly to make sure that they get a vaccine as soon as possible. So I'm optimistic about that.
Now, should there be a vaccine available in South Africa? Should you take it?
That's a very interesting question. Let me speak for myself first. So personally, I would take the vaccine, because having the medical understanding of vaccination, it's basically like having a controlled exposure of the body to a controlled type of the virus, such that you do not come down with infection, rather your body develops immunity against the virus, such that when you are exposed to the virus later, you already have that immunity, so you don't come down with the sickness. So it's a bit risky, but I would say I'll take it, because I would rather take the vaccine than get infected with the virus. So I would say I would take it. Now, talking about general public, there are concerns. Let me ask you, are you going to take the vaccine?
I don't know, because with the, we've been seeing on our TV screens, they've been coming and telling us that it takes quite some time to actually generate a vaccine. So the vaccine that's going to be coming at this point in time will be something that has been generated in such a short amount of time. So the side effects, we don't really know, but hey, when the vaccine is here, then we will.
Yeah, but you must know that desperate times call for desperate measures, and there have been so many non-profit organizations, the countries have come together. COVID-19 has brought us together to unite against fighting this virus. So I'm very optimistic that yes, the process might be expedited, but it wouldn't greatly compromise the effectiveness of the research that should be put into developing a vaccine. And if that quality of time, effort and resources could have been put into generating such vaccine, I would by all means go for it. I'll take a shot of the vaccine.
All right, so thank you so much for joining us and giving us such an informative interview.
Thank you so much for having me on the program. It's been a pleasure.
And thank you for watching this edition of Let's Sit Down with myself, Baby Amina Fili. If you'd like, you can like and subscribe to our channel. Don't forget to join us every weekend as we give you your amazing dose of what's happening around us. Don't forget to like us on Facebook and follow us on Instagram. If you'd like to send your feedback, send it to Let's Sit Down with B South Africa at gmail.com. From my side and the team, it's a goodbye for now.
على الدنيا وفي أول ثانية فتحت عيوني خرجت من السكون